Hi, I'm Christy, and I'll be your host today on the Pursuit podcast. This podcast is going to change your life. Watch it and recommend that your family and friends watch it. We have Dr. Myriam LaCerte today. Dr. LaCerte is a brain injury specialist and treatment provider in our community. Not only does she teach you how the pathways in your brain are built, but how we can create new pathways that will lead to a healthier and happier and more peaceful life. Welcome to our podcast, and I'm really excited about this next podcast. I think you'll really enjoy it.
6-9-foot pursuit. Stop! Stop!
Hi, Myriam.
Hi.
Thank you so much for joining us.
Thank you. Glad to be here.
Yes, I'm so excited. I have a little confession to make.
Okay.
I am like a brain nerd.
I love that.
Yeah, I have just as much little information to be dangerous, though, and I need a whole lot more because I'm just fascinated by it.
I'm glad.
And I'm honored to have you here.
Thank you.
Can you introduce yourself?
Yes. So I'm Dr. Myriam LaCerte. I am a physiatrist, which is a physician that work with musculoskeletal injuries, spinal cord injuries, brain injuries, anything that has to do with lack of function and recovering and getting back to your normal life. So it's a very broad field, but at the same time a small field. And then I'm a brain injury medicine specialist where I did a fellowship after going to medical school, doing residency into physical medicine and rehabilitation, which is also the name for physiatry. And then went and did my brain injury fellowship. And now I work as a brain injury physician and a physiatrist here in our community. And I do a little bit of everything to serve the needs of the community, but my passion is also the brain.
Mm-hmm.
Yeah.
What made you want to be a doctor?
That's very interesting. I think I've always wanted to be a doctor ever since I'm a little girl. My mom was a nurse initially, and then she left the profession. But we were always talking about the human body and science and watching surgeries and things like that. So I think I always thought I would want to do that. And then I played sports in college. I played basketball, and I had a concussion. So at the time, I had a lot of cervical pain, neck pain, and everything. So I went to a chiropractor, and that helped me a lot. So I was like, you know what? I'm going to be a chiropractor. I'm going to be a doctor of chiropractic. So that's what I did at first. I started when I was 18, finished early, practiced for a little while, and I was like, you know what? There's more that I want to do. That's when because I'm originally from Canada, so that's when I was in Canada. So went back to medical school here in the U.S. and did my whole residency training, parts of it in Detroit, Miami, and then my fellowship in Boston. So here I am. So then what got me into brain injury? Well, initially, strangely enough, I thought I was going to be an OBGYN. I loved female medicine and everything. When I was doing my rotation, I was like, absolutely not. I don't want to do that.
How come?
So then it's a really rough field. I remember being in a C-section and the blood's coming out and women are just kind of, it's like one birth after the other. And I thought it'd be like nice and sweet and tender, and it was pretty rough.
Yeah.
So I was like, I don't want to do that. And then my aunt, my aunt had a stroke. So then it kind of got me into I was in medical school at the time, but I was like, I need to get to know more about this pathology, what's going on, how do we recover from that? And then that led me to this path of being super curious about the brain and initially wanted to be a neurologist and then changing to be a physiatrist during rotations where I really wanted to be involved in the rehabilitation process of things, not just diagnosing someone with a neurological condition, but I wanted to be part of their recovery.
Sure.
So that became my passion, and then I became a physiatrist and a brain injury physician.
And here you are today, and congratulations, because that does not sound easy.
It was hard. We talk about the brain and things like that. There's a lot of the trauma that are associated with going through medical training, whether it's, the lack of sleep or the bullying that you experience from peers or attending and things like that, or, being on call all the time. So your nervous system's always ramped up. So that, sometimes you wonder how you can think if you work 30 hours in a row. So I remember after residency and fellowship, feeling the need to recover and just kind of go inward and like, what just happened? Now I've finished. I've completed everything, checked all the boxes. How do I recover from that for myself? There's a lot of depression and suicides in physicians. And once you start your training, you understand how that can happen.
So when you say bullying, is it more like a competition of who can be better?
There is some of that. I think there is, the way you are a physician when you are a resident, but you are under an attending, depending who that person is, what their approach is to teaching. Are they going to put you on the spot all the time? Or are they going to belittle you? How are they going to talk to you? Are you going to get yelled at? So there's a lot of that involved. And I think there's a lot more discussions about that, but I think most physicians are very type A, so it's like, we're just going to get through this. I always felt, is it really necessary? Do we learn that way under stress?
Well, right. And we talked a little bit, and we're going to talk more about the ego.
Right.
And what kind of personality traits can come out of that, negative or positive, right?
Right.
So how long did it take for you to get through medical school? Is it different from, you started in Canada?
Yeah, so every country is different. In Canada, in the rest of the world, I would say, if you think about Australia or UK or Canada, well, not the English-speaking part of Canada. I'm from the French-speaking part of Canada, so we're a little different. But in our parts of the world, you basically do high school, and then you go straight to medical school for 6-7 years. Whereas here, you'll go to high school, undergrad for 4 years, do medical school for 4 years, which is what I did, 4 years of medical school. Depending on your specialty, I did 5 years of specialty, and then you're good to go. So it depends from country to country, but here in the US, this is the path. So it's quite long.
Well, we're happy to have you in our community.
Thank
Sound
you.
like you are an amazing asset.
Thank you.
So if I were to go to you as a patient, what do your patients typically look like?
It will depend. I cover different services, so it'll depend. I can have patients with a spinal cord injury. So for example, they were involved in a motor vehicle accident and they have a spinal cord injury. They have a brain injury, so severe head trauma. I may see them as a consultant in the ICU while the intensivists and the neurosurgeons are making sure they're staying alive, and I will make recommendations to optimize the care. I can see them in the clinic once they went through the whole process where I see them as outpatient. They're at home, but they come for further management, adjustments of their medications. I may see them on my rehabilitation floor where they've completed the acute state, the acute care in the main hospital, and they come to my floor, and then we start rehab with the physical therapist, the occupational therapist, the speech therapist, and then we get things going for them to get them home safely and with as much function as possible.
So what's the difference between a brain injury and brain damage?
That's a really good question. So the way I look at it, so you have a brain injury, which is a broad term to say there has been some damage to your brain. Now, is the damage more functional or is it structural? So that's where you start differentiating between a concussion, where you do not have structural damage, but you have functional damage. So you see that, our kids playing sports and everything. Then you have the actual brain damage where you will have a bleed, you'll have a skull fracture. That's a moderate to severe brain injury. And then you have the mild brain injuries that are usually not necessarily accompanied by a bleed or structural damage, if that makes sense.
Well, an injury can heal, can brain damage?
Anything up to a certain point can heal. For example, a concussion will heal. most likely, but you'll hear people, and we can talk about that later. You'll hear people telling you, I've had a concussion a year ago and I still have issues that can happen, but it doesn't mean they had brain damage. And you can have people with a moderate to severe brain injury with a major bleed. They will either die, not recover, have severe morbidity, or some people actually turn the corner. And it depends where, what interventions were done, and what was their premorbid function, like how were they functioning before. There's a lot of factors that tie into this. But you asked me earlier why I like the brain. That's one of the reasons, because I'm always surprised by how people recover. I remember having patients, I would see them in the ICU, we almost gave up on them. And a year later, they're like, hey, doc, I'm back to college. So that's why I'm a physician pretty much, so, yeah.
So what goes into their rehabilitation?
So a lot of it is, you have different phases of care. So you have the acute care where we make sure you're stable. So you may need a brain surgery. We may need to evacuate the hemorrhage or the hematoma, they call it, in the brain. So we make sure we keep you stable. Once you're out of that phase, then how do we're going to talk about neuroplasticity, I assume, but how do we work on that neuroplasticity for your brain to recover? So you come to our unit, we may use medications, make sure that we address all this, the sequelae of a brain injury, but we start your therapies. So we're going to teach you. Some people need to learn how to walk again. Some people need to learn how to pour water into their cups. Some people and families need to be trained as well. So we'll train families, educate them on the process. And then the third phase of it is, okay, now you're home. How do we make sure you don't have further complications from that brain injury? And how do we manage your medication? And how do you become a productive member of society again, if possible?
So when you were talking about getting them to their highest potential, and sometimes they even need to learn how to walk again, is that like they remember how, and they just, their brain, the mind and body isn't connecting, or what happens there that you just forget to walk or you lose the ability to walk?
So most of it is because there is so much disruption in the brain, structural damage, that those neurons, those areas of the brain where you had that information stored are disrupted. So now we need to teach your brain to make new connections. You need to relearn sometimes how to speak. So we need to make new connections. That's
okay. And aside from an injury, can we do that anyway?
yes.
Okay. I mean, I'm asking because I think that, I don't know, it's my opinion, I guess, but a lot of people are unhappy, it seems, and kind of in a state of just going through the motions, and sometimes do want a new life. And at what age can't you learn, I guess?
Really none. You can learn until the end. Obviously, if you have severe dementia, you're out of the equation. But as long as you have a decently healthy brain, nowadays, in the past 20 years, we've realized that the brain is way more resilient than we thought it was. So there's always a chance to learn. We used to be told, like, okay, you turn 18, you're an adult, that's it, right? So now we know that the brain matures until you're 25 for a female and 28 for a male, which I feel explains a lot of things when you think about it.
Are you sure it's 28?
I know, I wonder. I think some people, the frontal lobe is a big part of our executive function, how we make decisions, how we perceive the world. Some people, I think, probably have reduced blood flow to that area of the brain, and you see these people, you're like, why are you making all these decisions? What's going on with you? It is possible that these people, their frontal lobe has matured, but there's not a lot of blood flow going there. And there are some physicians studying that with SPECT scan and seeing how, for example, mental illness pertains to how certain areas of the brain are working.
Absolutely. So if you have damage to your executive functioning, you said your front lobe, what can be done?
Well, I would say it pertains to brain health. So now, are you going to affect exactly the frontal lobe? Not necessarily. However, if you change your lifestyle, that could be a big factor. There are interventions that are still being studied, such as neurofeedback, transcranial stimulation, and things like that can help. But a good lifestyle, meditation is also part of a good regimen. Psychotherapy, you want to address your traumas. What have you been through in life? Are you so traumatized by your childhood that you're always in this state of, we call it sympathetic, your nervous system's always ramped up.
Fight or flight at all times.
Exactly. So that will decrease the blood flow in general to your brain.
Okay. So I have some questions for you.
Sure.
You can laugh, but okay. So I kind of think of thoughts that come into my mind kind of like slippery. I mean, sometimes I am very good at just looking at a situation and just observing it and not absorbing it. But other times I'll think about the same thing for a half hour, or I'll forget something. It's like my brain has control over me, not the other way around.
Yeah, I'd say in general, our brain has control over us, period. I think that's why it's probably the most important organ in our body, probably the least understood or the most misunderstood. But you're right, your brain has control over your body. Now it's interesting because where are your thoughts?
Where do they come from?
We don't really know. That's the truth. I don't think neuroscience is really, I think there's a lot to be done in neuroscience to prove where thoughts are. So I like the work. There's this physician or PhD, Andrew Newberg at University of Pennsylvania, studies like brain imaging and people meditating and monks and how things are working. And it seems that even with his research, we don't really know where consciousness is and how our thoughts are formed. So if you look at how the brain works, so for neurons to fire, you'll have ions like sodium and potassium that are crossing the membrane of the cell. This creates an electrical stimulation, which in turn triggers neurotransmitters. This will go in your little synaptic cleft, meaning the little space between your two cells, and fire another cell and create a reaction. So we know that. But now, where are the thoughts in this? Like, where is it coming from? So there are a lot of theories. Is the brain just a radio receiver, and we tap into consciousness that is all around us, kind of more along the lines of Buddhism and those kind of Eastern philosophies? Are we just receivers, tap into consciousness and, form a vision or like an idea of reality? Or do we really form reality from our brain? We don't really know that. I find it fascinating.
So do I. And you had brought up meditation, and I tried meditation where they actually told you to try not to think of anything. And when the thought comes, try to figure out where in your brain it comes from. And I tried really, is it from the front? Is it from the back? And now is an emotion. I feel like the emotion is supposed to be felt in your brain as well.
Yes, it is processed there, but where is it generated?
Correct, right.
And also, I kind of always laugh because if I ask you to close your eyes, and if you can close your eyes,
Okay.
Don't think of the color red. Don't think about
That's
it.
a really pretty red.
Okay, there you go. Right? So
Yeah.
it's the same. Don't think about anything when you
But I'll
meditate.
do that,
Yeah.
yeah.
So you'll think about something. So it's the same.
And I think it's odd that our brain keeps secrets from us. I mean, because let's say that I had cancer. My brain knows I have cancer. The part of my body knows I have cancer. I don't know.
Yeah, I'm not sure why that is the case. I mean, there might be symptoms and things. We may not look into it. I think there's a big part of our brain that is called the subconscious mind that we don't really tap into. It's like this black box. And I think that conventional medicine has still a lot to study about the subconscious mind. I think it's still, right now, when you think of conventional medicine and the subconscious mind, it's still in this kind of woo-woo realm. But it is a thing. I mean,
It definitely is.
yes.
So my background is more in like corrections, law enforcement, social work, and I deal with families that have basically gone through the same traumas generation after generation. How does generational trauma, I mean, when you're looking at a newborn baby, how does the trauma of their ancestors affect their brain activity?
That's really good. That's also a thing, I think, in conventional medicine that is not really recognized. A lot of the studies are done in rodents. So what we know, for example, is the state, like when they look at rodents and they study them, when you're in utero, the stress level of your mother will really impact how your brain develops. We know that. So now, is this set of behavior, learned behavior from your mother, your grandmother, passed on in the womb based on, your stress level, your thoughts, and, things that you're doing? And now, how are you impacting your children in this pre-verbal stage where, trauma can get imprinted in the subconscious mind? Unclear based on science. It's a little bit more esoteric. Does it mean it's not true? Probably not, because we've all observed it. We've all seen it. I see it as a physician every day. Now, how does that work exactly? Not exactly sure. We can look in the field of epigenetics, which means above the gene. So you have genes. We all have genes inherited by our parents. But, if you look at twin studies, twins will even look different when they're identical twins with the same genetic will look different when they're raised by different people. So now it's like, is it nature versus nurture? Is it entirely the trauma passed on, or is it how you raise your children? I think probably both. I think science has a lot to discover in that realm.
And how much of, when I was talking about, sometimes you can just get stuck on thoughts. It's like you're having a conversation with someone that's not even there. And at certain times in your life, I think that those thoughts do protect you in certain ways. They keep you, prepared. They help you remember things.
Yes.
They, all sorts of things. But at a certain point, I think that script that we build when we're trying to get, like in your case, through medical school and not sleeping and, having kids, being tired, whatever the case is, that after a while, that script that you've been using for 20 years really isn't serving you anymore.
Yeah, you're right. I think, we all develop a personality based on the things that we faced in childhood to survive, and we bring them into adulthood. And you're right, we reach a point where, is it serving us anymore to be defensive, not trusting people because you didn't trust, for example, your caregivers when you were younger? So, and I think that's where we need to learn how to rewire the brain, how to break the patterns.
Yes.
So.
But is it possible?
It is.
Okay.
It is. It is possible, absolutely. Obviously, I am not a psychologist, but as a brain injury physician, I know enough to tell you that, if you have trauma, you want to address it with psychotherapy. You want to bring it to the surface. We suppress things. It stays in our subconscious mind. So you want to bring it up. Why are you the way you are? But most importantly, learning new things.
Okay.
Interrupting your thought patterns is a big part. The default mode network is a big thing, and it's why psychedelics are coming to the forefront, because it breaks that cycle.
What did you say? This
Default mode.
default mode. What is that?
So it's like that. It's kind of like your ego. It's kind of that little voice that always does the same thing, that tells you that you're your little automatic thoughts, for example. Or, when you're driving your car and you're like lost in your thoughts.
All of a sudden you're at your house.
Yeah, and you're like, who drove the car?
Yeah.
That's part of default.
That's just
mode
scary,
network.
though.
I know. I think we do that to survive. So, and we live in such a stressful society full of stimulations all the time. So we're just trying to survive. So we operate from that network most of the time.
What are the daily things that we can do for brain health?
Well, I think the number one thing is sleep. I think it's really underrated. I was reading recently that in the 1900s, people averaged about 9 hours of sleep a night. So now we're at about 6.5. So that's a big difference. And recently, they discovered that you have a system called the glymphatic system. So that's your system that helps shrink your brain and drain all the oxidative stress that you've accumulated during the day. So if you don't sleep, that's not happening. So
That happens in the sleep process.
Correct, exactly.
So that's, when you say it drains, it's almost like it drains to restart for the day.
Right, it clears the brain from, the neurotoxins and the oxidative stress.
Wow.
Yeah, the glymphatic system. So we're discovering more and more things pertaining to sleep. So, number one, sleep. Just before the podcast started, we were talking about how people that have, for example, physicians like me, we don't sleep. Pagers going off. You don't sleep for 30 hours. You're awake at night, or nurses doing night shifts. So that affects your brain. So you are at risk of dementia in that situation. So that's a big factor. The other thing you can do is, a proper diet, proper balanced diet. Not too much sugar. We know that diabetes is a risk factor for dementia. We want to avoid that. Consuming a lot of alcohol is bad, so you want to limit your alcohol.
What is a lot?
A lot would be probably above, for a woman, probably more than 1 glass of wine a day, and a man about 2 glasses or 2 consumptions of alcohol. There's a study that came out in the UK kind of identifying different factors for brain health recently. I think it came out last year. And one of the things I thought was interesting is that too much alcohol is a risk factor, but in their study, they noted no alcohol. And I thought that was interesting.
What's a risk factor?
Apparently, I'm a bit conflicted by that one, because there's a lot of conflicting studies, but that's one of the risk factors. Exercise for brain health is just, super important. Will stimulate new nerve growth, actually, because you increase a substance called BDNF, which is called brain-derived neurotrophic factor. So when you increase it, you increase your odds of creating new growth in your brain. So exercise is a big factor. A healthy diet, social connections. Loneliness is extremely terrible for the brain. We saw that during COVID. People become depressed. They don't take care of themselves. They're isolated. So that's connecting relationships are important.
When you're talking about being depressed or just mental illness in general, does the brain look different when people are suffering from those disorders?
Yeah, so, it's interesting. In the world of psychiatry, and I am not a psychiatrist, but in the world of psychiatry, that's not really, when you go to the psychiatrist, you get a diagnosis for, say, depression. It's not really based on any imaging. But there are studies out there that are, looking at it a little bit more in terms of functional imaging and SPECT scans. And it seems like there is a difference for mental illness. Same for people that have narcissism, for example, is one of them.
I was just going to ask you, is the criminal brain, has that been studied?
I don't know for sure if the actual criminal brain has been studied, but I can tell you that traits like narcissism, for example, which I'm sure is prevalent, sociopathy, exactly, have been studied. And there is a template. It seems like there is a model for that, interestingly enough.
Wow. And so what if there was a cure for that?
I know, and I don't know if there really is one. I know in the conventional world, we would say probably not. Once you have a personality disorder, that's it. That's in the conventional world. Now, what is out there, I'm not sure what people are, how people are treating it outside of academia and, conventional medicine. But so far, the consensus is if you have a personality disorder, that's it. Now, do I completely believe it? Personally, probably not. I think we all have a chance at, changing and redemption. But some people probably need more work than others.
Mm-hmm. Well, I do think that obviously your brain is one of the most important organs, but there's just so little attention paid toward it.
Absolutely.
I mean, you got commercials about inflammation and eating. I'm sorry, I forgot the collagen and stuff like that, but I don't hear a lot about brain health.
I think, you don't really see the brain. It's maybe more important to have like nice skin and,
Sure.
I think it's like this little organ and, enclosed in the skull that we don't think about. But I think now with, concussions, athletes sustaining brain injuries, I think it's coming to the forefront. We have more and more dementia. So I think, people are starting to think, I don't want to be like grandpa, so what do I do? So I think it's changing slowly.
What do you think about our youth in contact sports?
Well, I remember I had an attending one time that told me when I was training, because people were like, well, I want my son to play football. Why not? So this attending said, well, if your son thinks cocaine is good for him, would you let him do that? Right? Because, in his mind, that was just as bad as playing football, contact sports. Now, do I agree? Probably. Would I let my son play contact football? Probably not. Soccer is also, there's a high rate of concussions with that as well. So, a little riskier as well. But I think that I'm happy to see all the progress we've made in preventing concussions, identifying them, and making sure that kids go back to play when they're ready. I think there's been a lot of emphasis on that. I think there's still a lot of work to be done, and I think that we need to reevaluate, how we let our kids play contact sports like hockey, football, soccer sometimes. I think that there are long-term side effects from having multiple concussions.
What are they?
Well, when you have one concussion, most of the time you'll recover really well, most people. When you start having 2, 3, 4, then it takes you more time to recover. So you can be left with, issues focusing, depression, brain fog. And later in life, especially if, the brain injury is more severe, then you're at risk of dementia later in life. So those are things to factor in.
How do you know when the kids are ready? You said don't send them back until they're ready. How do you know?
Well, you always, I'd say in that situation, you want to work with your athletic trainer, you want to work with the coach, and you probably want to work with a healthcare provider, a physician. They're ready. Well, usually there's like it's like there's different steps. So you want to see, are they still having a lot of symptoms? Number one, like, are they still having brain fog, headaches? Are they able to return to school? Because, you'll see that parents are eager to send their kids back to play, especially the kids that are competing, but they can't even finish school. So you want to focus on that first. So are they able to do their schoolwork? Now, are they able to take a walk and not have any symptoms? Are they able to run on a treadmill and not have any symptoms? Are they able to now lift weights? Are they able to return to practice without contact? Yes. Okay. Are they still having symptoms? No. Okay. So now you can start to slowly implement, practice and get back into the game. But it really varies from child to child or teenager to teenager. Everyone's different. How many concussions? how severe was it? Do they have other issues? Do they have other cervical issues or anything else?
Because I think that a majority of my friends that have played football will all tell me that they've had at least 10 concussions.
Absolutely.
And that they just didn't pay attention, like that was nothing. So in the was that going to have ramifications in the future?
It can. I mean, it can. And it depends on each individual. There are risks of depression as well. You see people, they've had depressions and it's really hard to treat. Well, did they have a bunch of brain injuries in the past? I was reading this article where we see homeless people, apparently they've had brain injuries at a rate of about 50%. So, they probably had, mental illness, they probably had a genetic component, but is the brain injury a factor in this? Very possibly.
Sure.
Are we addressing the right thing, trying to fix societal issues, but they actually have mental issues or actually structural damage, or they've had functional damage in their brains? So.
Wow. I mean, how do you know?
Well, you have to, when you work with patients with mental illness or anything, you have to do a really thorough history and ask good questions and really go in depth. And I think that it can become difficult because sometimes patients are poor historian, they have no social network or people to assist them into that. And we're just, we're so understaffed in the healthcare system. Even here in our community, getting counselors, it's very difficult to get our patients, seen, and I think it's throughout the country as well. So it becomes difficult to really do a thorough job when we're so understaffed as healthcare providers.
We had a healthcare provider last week who said the same thing. She said that the healthcare field is very, it's harder and harder to be a doctor for one thing, can't find anywhere to do a residency for another. And Great Falls isn't the only one struggling with this issue.
Absolutely. It's very difficult. I think after the pandemic, it became more and more difficult to keep our nurses, our doctors. People were burnt out. And I think a lot more is asked of you, documentation, insurance, dealing with insurance and things like that. So that's you have a lot of extra things other than taking care of your patients to do.
Is that a change? Did it used to be just seeing the patient?
I think it is a change because there's more and more box to check, than in the olden days, if you will. There's more pressure on physicians in that regards. You write a note, but it's almost like a billing sheet, for insurance. You have to prove this and that and this and that. Now you're focusing your time on performing these tasks, but you'd rather be talking to your patient and know what's really going on. And you can, but I mean, it's a lot.
It just takes time away that you could spend with your patient.
Correct.
Look at this paperwork.
Correct.
So if you get a traumatic brain injury, say you're riding a motorcycle, and you have a personality change after that, is that something that could just go away on its own? Or could that be something that's permanent?
It could be permanent. It could be permanent. There's a lot of people will have mood swings.
Right.
They'll have rage sometimes. And can you help with it? Yes. Can you dampen it? Yes. But oftentimes it can be permanent or it can be transient. But after a certain amount of time, sometimes it's just the way it is. And you have to just learn to deal with it, unfortunately. Yeah.
Okay. What would be the ways that you would treat somebody like that?
Sometimes time.
Okay.
The brain needs time. When you have, we think of a brain injury as a one-time event. The brain injury is a chronic issue, especially if it's a moderate to severe brain injury. It's not a one-time, now I'm good, No, it's a chronic issue. Why? Because you are left with a lot of neuroinflammation, so inflammation of your nerves, brain. So that can change your personality. That can, again, we talked about dementia, put you at risk of dementia. That can create the brain fog and your inability to focus and concentrate. So, so when you face that, you can do things like therapies, obviously, physical therapy. You can make sure you keep your brain active. You can do these things. There are medications to mitigate, the mood changes that come with a brain injury. But oftentimes when you reduce the neuroinflammation, you give time to the brain to heal, then you'll see changes. But sometimes you won't, unfortunately.
Your health journey is as unique as you are. The Peak Great Falls has everything you need for your fitness journey. They are your partner in wellness with a top-notch facility and expert staff and a very welcoming vibe. Locally owned, community driven. Join them today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, one cup and one bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. If you love a farm-to-table experience as much as I do, then you have to go to the Roadhouse Diner. The local McCafferty Ranch beef served on every burger. Try my personal favorite, Death by Bacon, today. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today.
So if someone goes to counseling, they do everything they can do. They're meditating. They're addressing traumas they've had. They have a situation they want changed in their life. Maybe they want a new life. What is your opinion on like psychedelic medication? I call it medication because that's necessary. That's pretty much what they're using it as medication to treat PTSD, sometimes head injuries. What's your opinion on that?
I'm super curious about it. For me, as a physician, maybe because I'm, from a different generation, I keep a really open mind. I think, from my perspective, I think that might be a key for the future. There are things like psilocybin that are being studied. Most of those studies are in rodents, like mice. But it seems like there is an impact on neuroplasticity, which seem to assist with brain injuries. There's a recent study actually that came out of Stanford, of all places, which is a pretty reputable place. And they used a plant called ibogaine, or an extract called ibogaine, which is from the iboga shrub African plant. So they use that with magnesium because when you use ibogaine, it can create heart arrhythmia. So, and these people really, they used, I think it was like 30 veterans, because our veterans are just plagued. I mean,
I know.
it's so sad.
Awful.
It's awful. And So they used 30 vets, and it seems like for about 1 month there was a big change in, mood and PTSD, because you have a brain injury, but it never just comes isolated, right? Especially those vets, they have TBIs, they have brain injuries, they have PTSD, and they have depression, anxiety. Which one came first? So it seems like ibogaine is promising. They probably need to do more studies on more than 30 people, but I think the fact that the medical profession and academia is opening up to it is a really good sign, and I think it's very promising, because we don't have a lot. We don't have a lot to help people, and especially when you put that in the context of PTSD, I think psychedelics are just really important. I don't think they should be disregarded at all.
What is your opinion on marijuana?
So, well, there's different parts of the plant. So there is CBD and THC. I think that I would not recommend, and I never recommend my patients with brain injuries to smoke marijuana with THC. However, there's a huge role for CBD, huge role. And the reason why is because it lowers neuroinflammation. So yes, so CBD appears to be neuroprotective, actually, to the brain. So I think there's a huge role. Again, more studies need to be done. And I think that once marijuana is legalized federally, I think there's going to be less hurdle for studies to be done, because I think there's a lot of red tape for people who want to study marijuana because of its schedule currently at the federal level. So once that happens, I think we'll see a lot more studies and a lot more information. But for now, CBD, I think is promising. It's definitely promising.
And you could take that in a capsule or in oil.
Yes, exactly. I would, you want to protect your lungs. As a physician, I would never advise people to smoke, smoke a vape or, any form of marijuana, but oil. There's gummies now. There's all kinds of different methods of delivery for CBD, and I think it has such an important role.
Interesting.
There's also, speaking of different modalities, there's hyperbaric chambers that are a little bit more studied now.
I've read that.
So there's not a lot of conclusive studies, but usually you have a lack of brain flow and oxygen to the brain. So at least with the hyperbaric chamber, you can, ramp that up. So, so I don't think it's to be disregarded either.
Well, I think plants have been used forever to be for a medicine. Peyote.
Yes.
I mean, just because it doesn't come from a pharmaceutical company doesn't mean that there's not a benefit from it.
Absolutely, absolutely. And I think, marijuana's had such a bad reputation, over the years. I think it's changing now with different generations of people. So I think that the taboo or the stigma that comes with marijuana is going to change, and we'll see a lot more people using extracts to heal themselves. It's very possible. It's hard as a physician to tell a patient, go use this. The reason is, well, it's not legal federally, but also we don't know yet the dosage or what ratio of, because there's different, there's CBD, there's CBG, there's CBN, there's different components to the plant. So now which one do we use? So I think there's a lot more research that needs to be done to establish protocols and dosages and things like that.
That's interesting. Do you think there's people who believe, scientists even, that there's no connection between your brain and your body? And I've read some articles about the things that we eat actually impact how we think, and our emotions actually come from our stomach. Is that true?
Yes, there is a lot of our nervous system is actually in our gut. And believe it or not, a lot of the neurotransmitters that are produced in our body are produced in the gut, like serotonin, for example. So we disregard that. So gut health is a huge factor for brain health. Why? Well, when you have a brain injury, for example, a lot of times you have such a stress response that your gut lining will become more porous. So some substances that are not supposed to be in your bloodstream will get in your bloodstream and create an immune reaction. Now
Your body creates that goes into your blood?
Correct. For example, I don't know if we take an example of whatever protein. So gluten is like the villain now, right? So you may not be sensitive to gluten, but you have permeability in your gut, crosses the barrier, the gut lining, goes into the bloodstream. The body's like, this is not supposed to be here. This is supposed to be processed, but now it's here. So it's going to mount a response like there's a microbe. So now you create all this inflammation and this immune response, and now you have this brain fog in your brain. So you see the connection between the two they're very closely related. And I think we tend to disregard that. And I think a lot more research is going to come out in the years to come about this.
I hope so. I can't wait. So what can we do for our guts? Our guts.
Yeah. So gut health. Well, nutrition is number one. Starts like nutrition. I mean, let's be real. In the Western world, we have atrocious health habits, bad diets. So you want to have enough fruits, enough fibers, right? So you want to make sure you have a good diet. You want to limit your stress level as well, because that will be impacted. You want to ensure you have regular bowel movements. I work in the hospital. I have patients that tell me, I only have a bowel movement once a week. Like it's normal. It's not normal at all.
How often should you be having a bowel movement?
At least once a day. Ideally, probably after every meal.
Really?
But, I think now we rely on coffee in our society to have bowel movements. But yeah, so you want to make sure that you work on these aspects, and I think it starts with a healthy diet.
Do you believe in color therapy, like chromogenics, I believe that it is?
I have not looked into the data. I've heard about it, but I've never looked into a lot of the data about that. At the end of the day, anything that helps blunt the stress response, because we all live under such stress and constant, what we call sympathetic response, like that flight or fight response in this day and age, that anything that can help that will certainly help your health in general, bring your cortisol level down, and probably help your mental health and such.
I just feel like sometimes stress feels like a runaway train.
Yeah, that's why I'm a big fan of meditation, because you break that pattern, right? You allow your body to get into this, what we call parasympathetic state, meaning the rest and digest. So if you're going to eat something, you need to digest your food. That's your parasympathetic nervous system kicking in. So you have to have that balance. You don't want to be always in the parasympathetic and just mellow and everything's fine. You don't want to be like always going, like society demands of us now. So you want to have that balance. So when you do meditation, then you can get in that parasympathetic state and break that pattern.
And there's, I'm not a fan of social media. I try to stay off it, but there are so many apps for meditation. If anyone's interested in meditation, is there a certain app you would recommend?
There's Headspace that I like. There is this app/device that's called Muse. I love it because it gives you this feedback. And I think there's a lot, there's going to be a lot more development coming along with neurofeedback. So Muse is one of them, and I'm not sponsored by them or anything. So I love that app, and it's like a headband, and it gives you some data on how your brain's doing. So it's nice because you're meditating, but then you have that feedback telling you how your brain's doing and how you can change it.
That is cool. I want to get it.
Yep.
I've got a question for you. This has to do with the sleep thing too. I just recently heard, I watched a video on a difference in sleep patterns and how people sleep now versus how they did in the pre-industrial time. So it's talking about biphasic sleep, and you're talking about the meditation and stuff, and that's what people apparently would do. They would go to sleep earlier at night, and they would wake up in the middle of the night, and then do the praying and meditation and things like that, and take care of whatever things they needed to do if they were farmers or whatever.
Yeah.
That type of thing, and then go back to sleep and then wake up in the morning and do that stuff. And I was just wondering if you had any, how that, would work out, if that's something that we could benefit from, or if it's something that a modern society wouldn't, tolerate or anything like that.
Yeah, I always find it interesting because if you think about how our lives have changed with industrialization and how our genes have not really changed, we're not different from those people, really. So, of course, better sleep patterns and kind of getting back to these habits would definitely help. I think one of the biggest factor that we see now is you have electronics, you go to bed and then you're like on your phone, and then you have that light coming into your eyes and just really blunting your response to producing melatonin, which helps you have a real good rejuvenating sleep. So we see a lot of people that don't have good sleep, low melatonin, and that's actually a problem. So the best thing we can do, short of living in a cave back in the olden days, is pretty much, turning off all your lights, not being on your phone before you go to bed and like scrolling. You talked about social media. That's not good either. Not only the content of what you see, but the light, the blue light into your eyes is pretty bad. I think few things that we can do, you see that in the kind of more biohacking world, wearing red glasses. So, taking out the blue light. So that would be really important. But I think, being stressed out, drinking, people drink coffee at, in the afternoon, eating late, things that we know, but we don't really do.
Right. Well, it's easy for us right now. It's so easy to make a bad decision. It's hard work to make every meal.
Exactly.
We got to get back to that. And what are dreams?
Wow, that's almost like a philosophical question. And I haven't studied the topic as a physician, but I'll speak just as Myriam, not Myriam as the physician. From my perspective, it seems like it's a time, we don't really know where the mind goes, but it's a time where we, all these subconscious things that we've stuffed during the day or the years, they come up to the surface and for resolution. And I think that's a good time, dreaming is a good time to address these things. From a scientific perspective, there's not a ton that I know about it, and I don't think it's been extremely studied, but from a just, subconscious mind perspective, I think that's where we're at with dreams.
Well, you close your eyes, it's fascinating. Like a movie starts. That could be a bad dream. It could be horrifyingly real.
That's true. And it goes back to consciousness. Like, where is consciousness? Where do we go? I don't think neuroscience has really established that.
I know, and I just think it's just so important not to. It feels like it should be on the top of the list.
Yes.
I'm very interested in it. I think it's absolutely fascinating. Especially, and I don't know if I let you explain neuroplasticity. It's just basically that a part of your brain that grows. Could you explain that a little bit?
Yeah, neuroplasticity is essentially the ability of the brain to be resilient, adapt to new changes, traumas, and build new connections. That's essentially what neuroplasticity is. And we used to think that, that's it, the brain is what it is, and you're done. Well, now we realize the brain is plastic, meaning has the ability to make new connections.
Wow, that is so cool.
I know, it's a beautiful thing.
It really, so a little personal story. I think that when I was like 9 or 10 or something, somebody told me that I wasn't an artist, I wasn't creative because I can't draw. I believed that for 20 years.
Oh, yeah.
Until I tried to do something, and I'm like, I am creative. But my brain kept that lie, and I believed that lie, and gave up a lot of opportunities that I could have had just because of something that I interpreted as a child that probably wasn't even stated in the way that it was meant to have been, like that's not a very good drawing.
Yeah. Yeah, the brain, especially when you're a child, we make meanings, right, to make sense of the world, and then we get stuck with these, and it defines our lives. So it goes back to, addressing those traumas so you can, grow to be your full potential. I mean, I was told when I was in first grade that I would never go to college. So thankfully I had an amazing grandmother who was a teacher, and she's like, no, I've worked with Myriam. She's plenty capable of doing everything. I just never understood what the goal of an exam was. I was like, I know this answer. Why am I not, why do I need to answer that? I just wanted to have fun and talk to my friends, and, so, and then I was told that, and I remember hearing that, and I was like, oh, maybe as a child, I thought I had some issues, and I'm so grateful I had a grandmother to tell me, like, no. You're fine. But I'm thinking of all these kids, and I hear that story a lot. Other people are like, oh yeah, I was told I was stupid, so I'm stupid. But they're not, right? So
as a child, you believe it is fact, though. And when you get to be an adult, and there is a lot of emphasis on learning between 0 to 5, which I completely understand why. And then we go into kindergarten, and then some of us go to college. But it's almost like after you're done with college, or after you're done with high school as an adult, that's it. That's your personality. That's what you got. If you're good at this one thing, you're good at that one thing. And that's just not true.
That is absolutely not true. And I think, one of the way to stave off dementia is learning new things. As long as you keep learning new things, your brain is going. It's, so I think if we, as a society, we stop thinking that you're done, you peaked in college, that's it. No, I mean, I know grandmothers that are 75 that learned Spanish.
So right.
Why not?
Why not? My husband and I are learning a new skill every year. So this year for me, I'm going to learn to play guitar, he's learning Spanish. And then I'm also learning like to cook weird foods, which Ben can tell you. He's my guinea pig. But
he's still alive.
Yeah, he's still alive. So
it's all good so far.
But I just really came to a point in my life where I just needed to slow down, and maybe you can speak to this as far as brain health, but my husband and I really kind of started over when we had children that could take care of themselves, and we were sleeping through the night and we're getting all of that rest. And then we started over with a brand new baby, and we weren't prepared for that because it was like a 5-minute warning, literally. So that almost brought me to a point in my life where I had to reinvent my entire response to things, the way I see things, because now I have an infant. I have teenagers, which is I have a profession, and my energy and my time and my focus just I'd change everything. And meditation helped me. One thing is in the morning when I wake up, I lay in bed for just a couple minutes and just kind of take an inventory of my body. Where is my body holding stress? I used to just jump right out of bed, go check my emails. What did I miss? Check my text.
Yeah.
Who cares?
Yeah.
Give yourself 5 minutes in the morning, and I just go through my body. Okay, you have anxiety there, or you have tension here, and I just kind of mentally breathe into that area. So when my feet hit the floor, I've at least got my emotions under control. I'm in control of the day. The day is not in control of me. But that's not always been that way. And it's been a lot of work to break some of these cycles that I had going that were not serving me, that I thought were.
Isn't it interesting? I mean, first of all, kudos. This is amazing. I wish all of my patients did that. But I think it's amazing because we learn all kinds of stuff in school, like, I don't know, like calculus, right? But we don't learn to take care of ourselves. We
No.
don't learn to take care of our brain. We don't learn to be present. And we don't have parents that are present. I think that's a beautiful gift that you're probably giving your children, or teaching them by doing it, to just be present and there. And it changes your day, and you have way more emotional regulation when you do that. And you're way more empathic to people around you. And that is so important. And we need this in the world. So kudos to you. I just wish they taught that to, young kids. I think there's a lot more meditations now being taught in school, and that has nothing to do with religion. Sometimes I hear people are like, well, it's not, it's prayer. It's like, no. This is like completely, like, from a scientific perspective, meditation is just its own thing. And I think that it's, it would be great if we could start doing that in schools, and, kids would graduate high school with skills, like personal skills, like meditating, emotional regulation. Who am I? How do I usually deal with that? Introspection. Like, we don't do these things.
And one of the things that I did, and I had to do it, was I had to write down. So I wanted to stop a particular behavior. And every time I wanted to do that behavior, I wrote down what my thoughts were, what my feelings were, and regardless of whether or not I did the behavior. But it probably took about 8 times of being confronted with that situation and me not responding in the way that I normally did for it to actually really feel like I was making any progress. I mean, it felt like I was spinning my wheels forever. It takes a really long time.
Yeah, so neurons that wire together fire together. So you had that neurocircuitry, right? This has been Christy for 20 years. This is how she's, responded. Yes. This is like ingrained in your brain. Now you need to break the pattern, make new connections. So you need to interrupt. And that's why sometimes psychedelic are interesting, because it's like that interruption on steroids. Now you're like completely out of your normal network, how your neurons usually work. Now you're like perceiving the world differently. And that's how you change behavior. I'm not saying everybody should go do psychedelic out there or anything. And if you do, please have the help of a professional. But I think that's where it becomes
Something's
interesting.
got to be done.
I agree.
I mean, I can't tell you the time I've wasted worrying about things that are just absolute. I mean, it's like my brain just like worrying about things, time I've missed out on this beautiful life that we've been given.
Yeah.
I think that any option should be heavily explored.
Absolutely. And we see people, science is always slower to catch up. Usually research will happen, and then in 10, 15, 20 years later, you'll see it in practice. It takes a while to get there. So I see people kind of going on their own and experimenting, and, I'm not condemning that, but I'm just, can I blame them when you see the suffering? People are looking for solutions. So,
People are suffering.
yes, absolutely.
And in the mental health field, there's not enough providers, but people are suffering so terribly.
Absolutely. And, I think also we don't always look at it, with a full picture. We talked about trauma and things like that, but we can talk about hormones too. It's like you may have depression, but is your thyroid not functioning well? Like, is your thyroid suboptimal? And I'm not saying not to take antidepressant. They certainly have a time and place, but, what's the real issue here? Are we, what is going on? Are you in a bad toxic relationship? Right? Because men that are married live longer, but women that are married live shorter lives. So
Say that again?
married men will live longer, but married women will tend to live less long than single women. It's a very interesting thing, I thought. We could delve into this.
I was never a feminist. I really am not.
Me neither.
But I will say I think that women are amazing. I will say that because there are so many differences in the female body and so many more challenges and so different hormones at different times, actually all through the day.
Yes, yes. Men usually have, like, their cycles are different, right? They're more steady. They have less hormonal changes. We're more, kind of different creatures. But you talked about differences so you know how we say women are multitaskers?
Yes.
So our corpus callosum, like the connection between our two hemispheres, is actually thicker in general. So that's why we tend to be able to, or it seems like that's why we're able to multitask, like kid in one hand, planning the dinner and the appointment for the next day, whereas, and I'm not bashing men at all, at all. We all have, we complete each other, but that's one of our strengths. And it seems like we help men live longer, apparently. So, and it seems to be, we'll seek out medical attention more, and, you'll push your husband to go to the doctor, take care of health issues. So, and
you take care of the people around you. You find your tribe and you take care of it.
Exactly. And that's why relationships are at the core of brain health, really. So, social connections, super important for brain health.
So what would you say, when you say social connections, do you mean like deep friendships? Do you mean going out and being social? Because do you ever feel like when you get home that you just don't want to go back out in public?
Oh,
am I the only one?
Yeah, all the time. I get home and people are like, oh, you didn't call me. It's like, I've been talking all day to people.
All day. I just want to stare at the wall and drool.
Yeah, so I think meaningful, deep connections, especially connections where you don't have to put a mask on, like you can be yourself and accepted however you are. I think those are the most meaningful relationships and the most important ones. Those are the relationships that you can get home and, not worry because you don't want to talk to anybody. I'm sure if you come home and you get home, you'll talk to Jesse, right?
Some days.
Some days, yeah. But it's easier to talk to the people that are close to you. So when I say social connections, doesn't mean like going to the bar and, meeting new people, although everyone's different.
Sure.
For some people,
well, and they
need
might
to
be
do
at a
that.
different stage. I mean, going to the bar right now to me would be like, can you turn the music down?
Yes.
It's too loud. Can I get a little more 7-Up in this drink? Because it doesn't, I'm too high maintenance to go to the bar right now. I would rather just be at my house.
Yes, exactly. And I don't think that's the healthiest thing to do. But being super lonely is pretty bad.
So the social connection, though, is very important, though, and we have lost a lot of that. Yeah, and you see, so there, I don't know if you're familiar with the blue zones, what the blue zones are, but essentially they are areas of the world where people live longer. They have less chronic illnesses. And they've been studied a lot. Why do these people live longer? Some of them are still smoking, drinking, like what's going on? And few things is, they have a good, healthy diet, balanced diet, healthy fats and whatnot. But a big part of it is they have social connections. And, if you travel the world, you'll see, people are out there, elderly people are out there talking and laughing, storytelling and things like that. And I feel like we don't, talking to neighbors, we don't see that as much here in the Western world. So these zones, people tend to have better social networks and people they can count on and people to check up on them and talk to and laugh and things like that. So I think we need to get back to this a little bit more. I agree. When Jesse and I had our children, when they were younger, we had family around, but we really didn't have like a tribe of people helping us.
Yeah.
And we do now.
Yeah.
And the things that they learn from other people benefit her, that she learns from other people benefits her so much more than we could ever teach her.
Of course.
And we've gotten away from our tribes, kind of.
Exactly.
I think that I heard that when the garage door was invented, that kind of did away with talking with neighbors because you don't have to get out of your car. You just go in, you shut the door, you don't say hi to anybody. Everyone sticks to themselves.
That's so true. I never thought about that, but that is very true. I mean, how many of us don't even know our neighbors?
I don't really, not very well.
Yeah.
I mean, I should.
Yeah.
I mean,
yeah.
really, truly, I would do anything for them. I just
Yes.
don't know their name.
Right. Exactly.
How much sense does that make?
Exactly. So that's the state of, where we are. And I just think it's a societal issue.
So if you have someone who's listening to this and they really want to change, maybe the relationship they're in, they've got to get out of these patterns. They've been in the cycle that you were talking about, that just keeps going on, in the loop that just keeps going on in their brain. To interrupt it, we could do meditation, exercise.
Yes.
What else? Because I feel like the world needs this so bad.
Your health journey is as unique as you are. The Peak Great Falls has everything you need for your fitness journey. They are your partner in wellness with a top-notch facility, an expert staff, and a very welcoming vibe. Locally owned, community driven. Join them today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, one cup and one bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. If you love a farm-to-table experience as much as I do, then you have to go to the Roadhouse Diner. The local McCafferty Ranch beef served on every burger. Try my personal favorite, Death by Bacon, today. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today.
Yeah, again, social connections. Diet, big part. Not overdoing it on refined food, sugar, super important. Preparing your own meals. Also, if you think about it, preparing your meals with your family around you. So you're making healthy foods. You're teaching if you have children, you're teaching them how to cook but you're also bringing the family together and bringing that, that social connection. So that's another thing. And learning new things, like you said, that's super important. Learning new things is a big key.
Just keep learning.
Exactly. Anything. Like you said, you're like, okay, my kids are, older now. I have more time. What is it that I liked when I was 12? Can I get back to this?
Yes. Can I be the person that I was before I was the person I was?
Right. Exactly. Like,
how do I get back to that old person?
Exactly.
And I think the first part is being grateful for what you do have. Now, don't look for what you don't have.
Absolutely.
Because we do have so many things. Anything pretty much at our fingertips.
Absolutely. I don't think we realize how lucky we are in the Western world. We have everything. You can be anybody you want. I mean, even if you're born in, lower socioeconomics, there's still an opportunity for you to climb the ladder. And I'm not saying it's easy by any means, but it is still available. Whereas in other countries, I mean, if you're born in the slums of India, that's it.
I know.
That's it for you, unfortunately.
But at the same time, some of the most miserable, nastiest people I know have the most money and the most power. So I don't think that's the answer.
I agree. I agree. You know, every time I see people, you know, mean or anything, I try to remind myself they're probably really unhappy.
Yeah.
I always remember that really kind of changed my life, actually. I at the time I was a chiropractor in Canada, and I was at the dollar store to pick up some items, and the lady, the cashier there, was so extremely rude. I was like, could not even get a hold of myself. I was so angry how rude she was. I get to the clinic and I tell all the employees, oh my God, this lady at the dollar store is terrible and whatever. And I just move on and forget about it. And one time I'm doing like new patient evaluations and things like that. And I'm talking to this lady, and she has all these issues, and husband's treating her poorly. She has all these health issues, child that died and things like that. And then I'm asking her, so what do you do in life? She's like, I work at the dollar store. And then it just comes in full view. And I'm like, oh my God, this is the cashier lady. That
I would be
was
crabby
just,
too.
Exactly. And I was like, oh my God. So it's just like, I was like, all right, empathy.
Yes.
You're not treating people like that because you're happy in life, you know?
For sure.
Yeah.
But also, I think we need empathy for ourselves. And when you were talking about the self-care portion,
Yeah.
when I was talking about when I was putting in all this hard work, I knew the self-care, it had to come. But I thought that taking care of my responsibilities was self-care. I thought
Yes.
that going to work was self-care. I thought that if I call this person back right away, I mean, I'm a great employee, so that's taking care of myself. And I don't have a time for anything else. But now that I've started meditating and started just doing like little things for myself, I have more time in my day than I know what to do with. It's the weirdest thing.
Yeah.
It's because the rest of the time in the day, I'm not worrying about the things that don't even matter. It's just, it took a long time to get over that hill, but once you get over it, it's amazing. Not to say that there's not going to be so many more struggles. You know, that's what it is.
Yeah. Yeah. And you're probably more focused from the meditation. But I think self-care sometimes is saying no.
Sure.
And when you show up in a more authentic way. So I think that's really important. You're not showing up and then you're going to be like, upset. It's like, oh, can you believe it? She asked me to do this and I went and I did this and that and I helped her out. It's like, if you don't want to do it, don't do it.
Yes.
If you show up, then you're showing from your authentic self and you're doing it because you want to do it. You want to help. So I think we learn to, I think as we get older, at least I do, it's like you learn to differentiate. Do I really want to do this? Am I approaching this from the right place or not? So.
Well, when you meet somebody for the first time and you get so-called first impression, but I consider it when I meet somebody, I can almost like feel their personality, like feel their presence. Do they want to be here? Are they interested? Like you can almost kind of not tell everything about a person, but get a pretty good idea. And I guess that is part of someone's personality, but that I think it takes a lot of work to be positive because there is a lot of negativity.
Yeah, well, we come with our sets of beliefs, right? And then we go out there in the world trying to validate our beliefs. We're not trying to change them necessarily. We're not trying to see the world differently. So it's like, I have to be right. This is my belief, so this is what's going on. And you build a personality around that. And I think that's what's hard to change.
So how do you separate out your personalities from your core values? Because we do need core values, I believe.
I do. I think that's an interesting question. And now we can delve deeper where your core value is coming from. Because you may want to reevaluate that. Is that a cultural thing? Because everybody, you go to different cultures, they have different values. So is it your true, is it really Christy, or it's, what's going on in this country, in this state, how your mom told you should be, right? So I think core values are important, but I think we always have to question where they're coming from. I do think they shape our personality. Our beliefs will shape our personalities and how we present in the world, but I think we always need to question things because our mind is, we're always influenced. I mean, you watch TV and you're like, oh, I'm hungry now. Why am I hungry? I wasn't hungry. It's like, well, you're watching like 5 Burger King, McDonald's commercial. So are you really hungry? Are you someone who likes McDonald's, or you're just influenced? So I think we always need to keep that in mind.
Sure. That's a really good point. Where do your core values come from? What age do you develop them? And maybe do they change?
I think they can change. I think a lot of them are like 0 and 6, right? Between age 0 and 6. But I do think that we have the possibility to change. I like the work of Dr. Joe Dispenza when it comes to that work. He really goes into like meditation and rewiring your brain, and he started doing studies, which is always interesting to see how he does the meditation work and how the data correlates. But he has a ton of anecdotes of people that changed their lives entirely just through meditation and changing the way their brain is patterned and their beliefs. So I think there's a lot more in the pipeline in terms of research about that and how we can implement that. And I think with the mental health crisis, that's going to be very important to revisit.
Is it true that we only access, I think it's 10 or 15% of our brain?
From the data I've seen, it is true. Now, are there ways that we can change that? Most probably, brain plasticity is, helping our brain plasticity is one thing. Psychedelic, I'm not saying to go take psychedelic, but it seems like more areas of your brain or areas of your brain that were not active are now active with psychedelics. So I think, the brain has more capacity than we think. Hopefully over the next year with different modalities like transcranial stimulation, the new psychedelic, neurofeedback, maybe we'll be able to expand how we can tap into our brain potential, but it seems like it is still the case that we're not fully tapping into our brain capacity.
One of the things that I did is that, I don't like to be uncomfortable and can get a little whiny. My husband says, I don't think so, but put yourself in an uncomfortable situation on purpose. And in my case, it was a cold shower.
Oh, yes.
And work on your breathing and breathe through that, because you're not going to like it. And when the next stressful situation, because we don't have like bears coming into our camp. I mean, we do get the adrenaline, right?
The sympathetic
we
response.
still have that happening. And sometimes, have you had people talk about when they have the sympathetic response for no reason?
Yeah, I think people, we have triggers, and it goes back, I think, to the subconscious mind, and we may not identify them. So, and we're so disconnected nowadays because we just always have to push through everything. It's like you got to go to work. You had, I don't know, your child broke her leg. Can you stay, or you just have to go to work? You just have to, just act like everything's fine. So we have to just push through. So we're completely disconnected usually from our emotions and feelings, right? So
what comes first, a feeling or a thought? Or an emotion or a thought?
Good question. I don't really think we know that, because we don't really, back to what we were talking about earlier, I don't think we really know exactly where our thoughts generated in the brain, which is a fascinating thing.
They're kind of generated a little bit in your stomach. And then
the gut
they're
feeling.
influenced.
Yeah, I mean, you have a lot of your nervous system in your gut, so it plays a role, but where are they generated exactly? Hard to say. I think neuroscience is a lot to prove still in that field.
And the feeling of love and what that does to your brain. Can you talk about that?
Yeah, that's interesting. So I'd say, like new love, when people fall in love, it's kind of like cocaine for the brain. So triggers a lot of dopamine and everything. So I think, when people make decisions based on that, I think you probably want to get out of the phase where your dopamine is super elevated. Let that sink in when you're more like, there's like an opiate response, meaning you see that person, you feel good, but you don't have that high. Because now you can now you can observe them from a place of who they really are, not your idea of who they are based on the dopamine response. But yeah, new love, falling in love just ramps up your dopamine. So you want to, it's a great thing, but that's not actually where, relationships are built. Relationships are built when you have that like opiate response and you see that person, okay, I feel good, this is safe. So love is great, but healthy love. And it does, you see it in the brain.
So when you're talking about healthy love, an example I would give is someone who's really codependent and they're going into a relationship out of a place of need, out of somewhere they need to change, and then they start a permanent relationship, like maybe get engaged or get married in that state where they still need to heal. It's just like pushing that healing process down with then maybe a divorce or something later.
Yeah, especially I think, not really from a scientific perspective, but we all know that, relationships can be triggering, right? So yeah, I think there's a lot of it goes to childhood again, going back to childhood. How was your relationship with your primary caregiver? Did you have to work for love? Were they emotionally distant? Were you neglected? Were you abandoned? So you're clinging to relationships. So I think a lot of people disregard these patterns and then they go into a relationship and they're completely lost, and you're right, lead to divorce or chaos or unhealthy relationships, which are not good for the brain.
So we've got to take care of ourselves first.
Absolutely.
We just got to.
Yeah, absolutely.
And then worry about the relationships.
Yeah, absolutely.
What other things in life other than love, I would imagine childbirth brings out a lot of, in male and female, I guess. Is it oxytocin?
Yeah.
Or, okay.
Oxytocin is a big factor, also helpful for brain health. And it's interesting because I think males and females process it differently. So you know how if you have a problem, or females in general, and obviously these are generalization, everybody's different, but in general, females you have an issue at work or whatever, you'll be like, you want to talk about it. You want to call your friend or tell your husband, like, this is what happened. You go into details and you need the feedback and the connection, and then you ramp up your oxytocin from that.
Oh.
So it's good for us. For a male, might be different, right? You don't, like, a guy will be like, I'm just going to deal with it. I don't really want to talk about this. You see that a lot. So what happens when the oxytocin increases for a male lowers the testosterone. So that's not necessarily their comfort place.
Interesting.
So that's one of the things that you'll observe. So when you know that, you may have a little bit more empathy for each other.
For men if they don't want to talk about their day.
Right. You just let them go, kind of restore their testosterone, just deal with it.
Interesting.
Yeah.
So, and that's like the happy feeling, oxytocin.
The connection. It's the hormone of connection.
It's the hormone. So is oxytocin a hormone?
Yes. Yes.
Okay.
Yes.
And antidepressants, how do they work?
Well, they influence your reabsorption of serotonin, increase your serotonin production. So the idea is that you should be happier. So there's a place for them. Now, is it the only answer to mental health? Probably not. Has it helped a lot of people? Yes. But there are risk factors too that people kind of disregard. Sometimes it can be difficult to get off of them, you know, and, you know, everybody's different. Sometimes there are, you know, people will gain weight on them. People will feel numb. People will, you know, experience more suicidality. So you have to, you know, let your patient know and let people know that these are risk factors, or, you know, side effects that can happen, I mean. So are they, you know, should they never be used? No, but I think we should always keep in mind, look at things holistically. Like, I'm dealing with a person. Is just giving a pill the answer? Or should we give a pill but address everything else too? Or is that a pill that they need and they need something else to be addressed in their lives? Do we need to address brain health first? You know, are they drinking all the time and they're depressed because alcohol is a depressant? You know, is a pill going to help that, or should they just quit drinking? And now, why are they drinking all the time too? Like,
Oh, it's
you know,
just a rabbit hole.
Right, exactly. And you know, honestly, most of us in the healthcare field, we don't always have the time to go down that rabbit hole.
Well, yeah, I mean, yeah, of course not.
Yeah.
So what do you think about sleep medication?
I think that they may have a place for people, like, you know, you'll see veterans, they haven't slept in days. At some point, you know, you gotta sleep, you gotta use them. They have their time and place. But I think just starting with interventions like we talked about, where, you know, you want your room to be completely dark, you don't want to be on your electronic devices, you don't want to drink coffee, you don't want to drink a lot of alcohol before bed, you don't want to eat too much. All these things are really important. You may want to journal, get your thoughts out there and just put it aside and go to sleep. Are you working in your bedroom? Like, are you doing all kinds of work and then you go to bed? Or is your, you know, your place of sleep a sanctuary? So I think those things are important. Melatonin, sometimes just something as benign as melatonin could do the trick and should be tried first. I think that's, you know, not everybody tolerates it, but if you can, that's more benign. Then you can start thinking of sleep medications. They don't always give you the same sleep, the natural sleep that you would get, but at least you get something, because, you know, you got a pattern interrupt at some point.
Are there certain behaviors, when you were talking about, you know, kind of when people make major decisions, when they start dating because they're feeling so good, how does that go into like certain addictions, like gambling or things like that just get you hooked?
I think it all boils down to dopamine. So some people get kind of addicted to that dopamine high, so that new love gives you that, right? So you have, and that's why you have people with sex addiction, and like they go from one relationship to another because they need that dopamine high. It's like, oh, I've been with this person, because after 3 years, usually that wears off typically. So it's like, oh, now I have to go to the next person. Well, I need my dopamine high. But gambling's the same. You get that dopamine high. Any addictive behavior, video gaming, or, you know, playing.
Do you think like kids on Facebook, is that a dopamine when they open up their account?
Absolutely. And that's why they say like the attention span now is like zero, right? So you had, you know, I would say I'm the Instagram generation. You had the Facebook generation and the Instagram generation. You have the TikTok generation. It's like, how long is a TikTok video? It's just,
Yeah, they don't want to watch anything more than 10 seconds.
right. Nobody reads anymore, really. Who sits down and reads a book anymore? I mean, it you know, the younger generation, it's more rare. So, you know, because we need that constant dopamine hit, dopamine. So we need to learn to break that cycle too.
Why is it?
I'm sorry, I was just going to interject there about reading books, is that what I found is they really help you sleep.
Yes, that's a good point. And you don't have the blue light in your eyes.
Exactly.
So,
They give
yeah,
you something to work on, and then eventually you're just going to drop out. So
very
it
true.
works great for me anyway.
Very true.
Depending on the author, right?
Hopefully nothing scary.
Well, so this is kind of I think some people think it's kind of foo-foo, but I don't. I think it's believable. I think you can manifest your own reality. If you really pay attention and try to control your day, not let your day control you, obviously things get out of our control in life, and that's just going to happen. But do you know what vision boards are?
Yeah, I've seen those, and that's something I'd like to try one day. I've never done an official one, but I'd like to do that. Yeah, I do think that, you know, they did studies on like people who set goals, just that alone, and how further in life they get when you have set goals for yourself. So I can only imagine that, you know, having a vision board and, you know, looking at it and telling yourself that you can achieve this, or this is possible for you. I can only imagine that it makes a difference. But is there any data that I've seen on that from a scientific perspective? Not really, but just from a purely kind of gut feeling, I would say, why not?
When you were talking about how relationships are kind of at the core of your brain, can you explain how when you're really close with somebody, maybe you haven't even talked to them for 2 or 3 days, you could just, they pop into your mind at the very same time they call you, or something bad is happening to them? Have you ever experienced that?
I've experienced that plenty of time, and I don't have a scientific explanation, but I can only, you know, if you see from different tradition, like if you look at the Buddhist, or, you know, like the fabric of consciousness and how interconnected we all are, is it possible that these things can happen from, you know, and you're right, it's more woo-woo, but I've experienced it. And so the fact that, from that perspective at least, if we think that we're all connected, I think it would be normal that such things would happen. And it kind of goes back to, you know, treat people the way you want to be treated, because, you know, in these traditions, for example, you are a reflection of each other. So, you know, now that's not me talking as a physician, but just, you know, I spent a lot of time in India and in Southeast Asia, where they have different beliefs and different ways of thinking. And that's one thing that I like to think is true.
They
we're
believe
all,
that?
that, you know, there's a fabric of, you know, consciousness. We're all connected.
Okay.
And I like that idea.
I do too.
I really do.
What other ways do they believe that are different?
Oh my God. So many. Well, one of them is we can get woo-woo even more. Reincarnation is one of them, right?
Okay.
So they believe in that. You know, there's different doctrine of, you know, a lot of, so you go to India, there's vegetarian, so do no harm, right? Not eating meat and things like that. There's so many different ways of thinking.
Yeah, there really are. And there's Hinduism is fascinating.
Yeah.
And then Buddhism coming off from it is like, it's all really interesting, and it's a completely different way of thinking than we're used to over here in the West. So I would recommend that everybody go have a look at that stuff.
Yeah, because I mean, they're the ones that started introducing meditation to the West, right? You had those yogis coming in, you know, the Beatles kind of made it popular and everything, but they came in with gifts of, you know, meditation and kind of going in words, and, you know, how to cultivate consciousness and things like that.
Well, it's just been fascinating talking to you.
Thank you. Likewise.
If there's one thing that you could like teach all your patients in a preventative way, what would it be?
Preventative way. I would love to see people adopting a healthier diet. I would say that would be a great start, because, you know, when you're healthy in your body, you're healthier in your mind, you're happier. I think a healthy diet would be a really good start. And again, connections, healthy relationships, dealing with your traumas. I think those would be like the 3 main ones. But I think the diet's probably the easiest part to do if possible. So yeah, healthy diet starts at home, and it starts with that.
I really enjoyed having you here.
Thank you.
I learned so much. I
Likewise.
just have even more questions though, but I really, really enjoy talking to you.
Likewise.
And our community is so grateful for you and all that you do. Thank you.
Thank you. It's a pleasure to be here. I love it in Montana. I love our community.
Good.
Just good-hearted people, and I'm just really glad to be helping.
Good.
Yeah. Thank you.
Hey everybody, Jesse Slaughter with the Pursuit Podcast. And we really appreciate the amazing support already that this channel has received. Our social media is blowing up. Everywhere we look, people are liking and clicking and commenting. But what we really need you to do is subscribe to our Facebook page and follow us on Spotify. That's what drives this channel. That's what's going to keep this channel going forever. Tim and Ben are behind the scenes doing tireless editing, working on this to make this come out the way it does, this high quality product that it is. So please go in there, click subscribe, click follow, and make sure that this channel sticks around for a long time, because we truly believe it's doing a lot of great things for our community. But there's many, many other people out there who we need to support. So follow and subscribe today. Thank you.